Okay, so today we're doing resin fillings, and we're going to show you what we have out in front of us. We have a curing light, which we'll need to cure the composite material, which we have right here. We're using the shade A1, and you always want to have the shading guide to show you which best matches the patient's tooth shade. So we're using A1 today, and with that, we have etch, because you have to etch the tooth. We have our basic setup, which is a mouth mirror explorer. This is a Woodson, but also known as a turno, which you use this to help shape the composite material when you put it on the tooth. And we have the numbing jelly, petroleum jelly, because we're going to numb the patient's tooth first with anesthetic. Sure, that's that. And then we have cotton forceps. So basically that's all you need to start off with. So now we're going to take it to Morgan. She's going to tell us what we do next.
Okay. Starting off, hi Morgan. Starting off, we're going to numb the patient. Okay. You're going to let that sit for about 5 minutes maybe, and let that soak into his gums. 5 minutes has passed. We're going to numb him with the anesthetic. Usually during this time the assistant is suctioning, so any leftover anesthesia stuff.
We're wiping this off because
You're supposed to be suctioning, but yeah.
yes. So normally, suction.
So we'll go down his throat and his throat will be numb.
Okay, so once you numb the patient, what you're going to do is, or what the dentist is going to do is, he's going to, with a high-speed handpiece, which we don't have with us right now. Basically, if this were a high-speed handpiece, he would take out all the decay and prep the tooth. So he takes out all the nasty stuff. I'll use this so we can try to make like a hole almost. So we can just say that this is a occlusal resin filling, so we'll just do kind of like tiny hole if we can. But normally the dentist would be using a high-speed handpiece and drilling in there. So once he drills the tooth, what he's going to do is, we're going to rinse it out, suction, make sure it's nice and dry. What he's going to do is, he's going to put etch into the tooth. This is not coming out. Well, you put etch on the tooth. Let's see if it comes out this way. There you go. It's really dry, but usually the etch is normally liquidated. So while he lets that sit, he's going to take the air water syringe, and the assistant is also going to put their suction right here. He's going to rinse it off, and basically this would suck it all up. And after that, you keep the HV on it so the tooth gets nice and dry. And since it's this composite material, you don't have to use Prime Bond. So once it's prepped, he's going to put Prime Bond into